Welcome to Lesson 8 in 213, Physical Disabilities and Personal Care. In this video, we'll talk about diabetes. Up until this point, we've largely focused on physical disabilities, things that were visible to us at a glance. Diabetes is different. It's a disease and it's often very hidden to us. In fact, we may work with people who don't even know that they have diabetes. Diabetes is a condition in which the body of the person loses its ability to regulate the conversion of blood sugar into energy. In your bloodstream right now is a solution of sugar dissolved in your blood serum. If that sugar level gets too high, it can poison you. And if it gets too low, then some of the things your body needs to do, including not only activity, but involuntary systems such as your digestive tract, your breathing, and your heart rate will all start to be in trouble. And so it's very important that the body be able to do this. In order to turn sugar into energy, our body relies on a hormone that's produced in the pancreas called insulin. And that's a naturally made hormone. And if we don't produce it regularly, or if we don't produce enough of it, we can be in some trouble. When our blood sugar levels are too low, we call this hypoglycemia. This can happen because we haven't eaten enough, or because the body has produced too much insulin all at one time. When you have hypoglycemia in a mild way, you probably describe it with a word like hangry, or you might say that you're fading because you haven't eaten in a while. But at its extreme, hypoglycemia is something that can be life-threatening. If a person has too much insulin, they can go into shock, or their system can start to shut down and they can go into a life-threatening diabetic coma. And you'll see a reading online at this course that will help you to get more information about diabetic coma. If you have too much blood sugar, we call that hyperglycemia. And now what happens is that sugar starts to essentially ferment or turn into other chemicals, making your bloodstream essentially toxic. In order to compensate for that, your body might start to sweat or force you to urinate too often, and that can cause you to have a deadly level of dehydration. So once again, you can end up in a diabetic coma. Both hypo and hyperglycemia, therefore, can lead us to be in a diabetic coma. There are two types of diabetes. One is diagnosed very early in life, and we believe it is passed down genetically to people. It's called type 1 diabetes now, but it used to be called juvenile diabetes just because it was diagnosed in childhood. People who have this type of diabetes are usually dependent on injected insulin because their body often lacks the ability to produce any insulin or can only produce very small amounts. And so they're usually dependent on it throughout their life. As a result, they're kind of used to being on insulin and have often learned to manage their symptoms from a very early age. People with type 2 diabetes are sometimes referred to as having lifestyle diabetes. And the reason that term has become popular is because this form of diabetes is diagnosed later in life. And it's often most common in people who don't eat very well or don't exercise enough. But in truth, there's usually a genetic component here as well. People with type 2 diabetes have a genetic predisposition. So if you know people in your life who have had diabetes, if your parents or grandparents have had it, and they have had an unhealthy lifestyle, you know that it's probably even more important in your case to maintain your lifestyle and be healthy in your diet and exercise than it is for the average person. People who have lifestyle diabetes, if they diagnose it early, can often manage it through lifestyle management, making sure they eat right and exercise right. If that doesn't work, so the next level is usually that people can take an oral form of insulin. But if they don't manage it well, they'll eventually end up on injected insulin as well. Not only is that very intrusive for people, but it's very rare for people to get off of injected insulin once they've started. So you can see the value in helping people to use good lifestyle management practices so that they will prevent or slow down the progression of this disease. So how do we help people to manage diabetes? The single biggest thing we can do, whether a person is taking medicine or not, is help them through good nutrition and exercise. When it comes to nutrition, people usually focus on eating whole foods rather than processed foods because the sugar in those is less likely to be digested all at once, causing the body to have difficulty to regulate it. Typically here, the sugar is dispersed into the bloodstream more slowly when you eat things that are in their natural form. It's also important for people to maintain consistent hydration because diabetes can cause us to shed water faster. Really, one of the most important things for people to do with both their nutrition routine and their exercise routine is to have something that is individualized and created by healthcare professionals, and to make sure they really do get into a rigorous habit. So they're doing things, they're eating at the same times, they're eating the right foods, they're exercising just the right amount. Too little or too much can be a problem. They should also avoid sugary foods, including those that might strike you as natural, but they may still be high in sugar, especially fruit, which contains the sugar fructose. Fructose, as far as the body is concerned, is just as dangerous as sucrose or other forms of sugar. And so are starchy foods that don't taste sweet at all, like pasta or potatoes. All of those types of sugar will be converted into glucose by your body and will all cause your blood sugar level to increase. So this is why people are encouraged to use sugar substitutes if they want to drink pop or eat candy. Even something like aspartame, about which you might have heard negative things, is recommended by the American Medical Association, the American Diabetes Association, and other organizations. As you may recall from prior lessons, it turns out that the science around aspartame that has many people worried was actually created fraudulently, and there isn't evidence that it's dangerous except for people who have a particular disease. So it's actually much healthier for people to use sugar substitutes like aspartame or acesulfame sulfate or stevia rather than eating sugar. And of course, good sleep and rest is also important, and so is hygiene. And you'll see why hygiene matters a little bit later on as we go down this slide. Checking the person's blood glucose routinely or helping them to make sure they do that is very important. They'll have a specified number of times that they do that a day, and they should try to do it at the same times every day and keep a record so they can see whether they're trending up or down. They should make sure whatever medications are on, they again take on time. It's particularly important with this diagnosis. They may take an oral form, they may take injected in the form of needles, or they may take a pump. One of the great things about the pump is that it does the testing and it doses the amount of insulin based on its own internal ability to read the blood sugar level. So it does a lot of the work for us, and we don't have to worry about adjusting insulin levels. So they're really good technology, and if a person is able to have one, it can lead to a higher level of independence. But one of the things you need to understand about a pump is that it needs to be properly maintained. It needs to, for example, have the site around it cleaned. It needs to make sure that it's not getting smashed as the person is out doing physical activity. It needs to have routine inspections by the technician. It needs to be charged or have fresh batteries put in it routinely. So watching its care is very important. When people have diabetes that is poorly controlled, they can start to experience a condition called neuropathy. And what happens in neuropathy is that the person's nerves start to fail in particular parts of their body. But really, where the nerves, we're worried about the person just losing ability completely. And the two most risky areas for people with diabetes are their lower extremities, their lower parts of their legs and feet, as well as their eyes. And so if a person doesn't maintain their regimen well by taking the right medicines and by eating and exercising the way they should, they're at high risk of losing their feet or losing their vision or both. And of course, that not only means that they're at risk of losing those peripheral, those parts of their body, but also of being exposed to infection, which is why helping people to maintain good hygiene can help buffer against that, especially if a person has had an amputation to their legs because of advanced diabetes. When people know that they're at risk of neuropathy, they often have, as part of their care plan, some monitoring. So it might be your job literally to check the person's feet and, for example, check on the color, or what's called cap refill, where you squeeze their toes, for example, and see whether or not blood comes back into the toe, if it goes from being pale back to pink quickly, and checking for sensation. So people usually notice that they go numb or even have pain in their extremities because of it. You may be asked to help people with special clothing, such as socks that apply extra warmth and pressure to help the circulation be good. And people may be expected to do a certain amount of exercise or elevation so they don't get too much swelling. It's also very important for us to be up to date in our first aid skills, including recognizing diabetic emergencies and knowing what to do if we see them. Some of the symptoms of diabetic emergencies include an irregular or fast heartbeat, and we take the pulse of the person at their wrist, what we call the radial heartbeat. We also may notice fatigue, particularly a sudden onset of fatigue that's not explained by activity, pale skin, shaking or tremors of the body or limbs. People often say they can't control or stop the shaking. Feelings of anxiety, sweating, hunger and thirst. A fruity smell on the breath, similar to somebody drinking grape Kool-Aid or chewing juicy fruit gum. Frequent urination, irritability, people feeling like they get angry easily. Tingling or numbness of the lips, tongue, or cheek. Confusion or abnormal behavior, people not being able to complete simple routines or forgetting what they were saying halfway through the sentence or where things are that they use all the time. And as these symptoms go down the list, they're typically worsening, and you can see that it's more and more likely that you'll need to get advanced medical care. Visual disturbances such as blurred vision, seizures, or a loss of consciousness. All of those are signals that a person might be experiencing a very risky diabetic emergency. And you'll notice that you're not asked to determine whether it's high or low blood sugar that's causing this. In our work, we're not medical professionals, so we're going to have a type of first aid usually that does not ask us to make a discrimination between low or high blood sugar. We don't have that ability. So instead, in our diabetes first aid, and I'm talking about in our professional life, in your personal life, you might test your blood sugar and decide whether or not step one is the right step. But typically what we do in a clinical setting is we give a person a source of easily digestible sugar, such as pop with sugar in it, fruit juice, a candy, a sugar cube, or a product called monogel, which comes in little foil pouches, and it literally is a gel of glucose suspended in water, so it's digested very quickly. And if the problem is low blood sugar, you'll start to see improvement very quickly. However, if the problem is high blood sugar, you really won't be causing the person any more distress. And the very next step will help to address that. And that is that we're going to seek medical help. If the person looks like they have some of the symptoms that were at the bottom of that list, blurred vision, confused behavior, seizures, or they're losing consciousness, you're going to seek help by 911. If it's earlier up the list, you might take the person for an urgent care appointment or walk into an emergency ward. If a person's taking a pump, using a pump, one of the great things about a pump is that it basically will do the testing and adjusting for us. But at the same time, if a person's using a pump and they are having symptoms of diabetic emergency, then you know their circumstances may be extraordinary, and I would definitely call 911. We want to monitor the person's airway, breathing, and circulation while we're either going to the doctor or waiting for an ambulance. And that means watching their breathing and their circulation, taking their pulse, and doing other parts of the secondary survey, such as recording their symptoms, making note of their medical history, and noting the pulse that we took at routine places, describing the last events before they started to have these symptoms and the last meal they had. All of that should be written down and passed on to the medical professionals. Remember that you will not be qualified to make a decision about administering an extra dose of insulin, or in most cases even to do an extra glucose test. And that's because, going back to something we learned in medications, you will have to have a delegation of task to do these activities because they involve piercing the skin. A delegation of task, a few things to remember about it. First, you can only get a delegation of task by being trained by somebody who is a medically qualified professional, usually a community health nurse. It's always specific to an individual. So once you've learned to give insulin to person number one, it does not qualify you to give it to somebody else. You'll have to be trained on each person individually. You'll have to be updated on those procedures every year. It does not last more than that. And you cannot transfer it or train somebody else and give them a delegation of task. So it's very important to understand that every procedure needs a delegation of task, and that the delegation of task only allows you to do what a doctor has ordered, not to make medical discriminations or choices. So you cannot give somebody an extra dose of insulin PRN. If you did that, you could be putting them at very high risk if you were wrong about what was going on for them. So look for some readings about first aid, about diabetes, and link to the video as well. But this is for sure something you should be able to address in your final exam in this course and in real life.